Ladies and gentlemen, welcome to our new program, which we call as Facial Plastic Surgery Talks with Masters. Today, we are so lucky because we have a very distinguished guest, my good friend, Theda Contis from the United States. She is an assistant professor in Johns Hopkins Hospital in Baltimore, Maryland. And as you may all know, this hospital, Johns Hopkins Hospital, is always among the top 3 hospitals in the United States. Theda is a board-certified facial plastic surgeon. She's the general secretary of the American Academy of Facial Plastic and Reconstructive Surgery. So, welcome, Theda.
Thank you for having me, Fazil.
It's a great honor to have you with me today. So we're going to speak on injectables today, and you have a huge expertise on injectables, and you have even written a wonderful book on injectables, which we all use as a wonderful guide for all of us, all of the facial plastic surgeons. Thank you very much for that.
Thank you.
So my first question to you is a question coming from the patients. They ask, what is fillers? What is Botox? Aren't they the same?
We hear that question a lot, Fazil. And actually, Botox or products like Botox keep muscles from moving. So we find that wrinkles in the face come from muscle movement, similar to if you're folding a piece of paper, eventually the paper will get a crease in it. That's a wrinkle. So if you're not folding the paper, the wrinkles are better. And that's what Botox does. Botox, we know exactly which muscles to target that cause a certain wrinkle. And that's what Botox does, is it stops that muscle from moving. Now, fillers are completely different. Fillers are volume, fillers fill. So the studies of aging show that when we age, we lose volume in our face. As we age, we sink in and then it falls. So with fillers, we fill those areas of the face that have lost volume to give us that more youthful look. We find that in youth, we have volume here. When we're older, we have volume here. So it's like a triangle. We want to turn that triangle up to put more volume in the upper part of the face.
Thank you very much. Some patients ask, oh, we heard that Botox is a venom. It's a poison. How can you inject poison on my face?
Well, Botox is a poison. That's absolutely true. Botox will cause botulism if that organism is ingested. And botulism is a terrible, terrible disease. But we have found that injecting small amounts of the botulism toxin, like 10 to 20 units, can actually paralyze the muscle or weaken the muscle that we've injected. Now, to get botulism, you have to ingest hundreds of thousands of units of botulism toxin. We inject 20 to 30 units, so it's really not dangerous. Also, talking about fillers and Botox, patients come in and they're terrified of Botox and not so much of fillers. And actually, for physicians, we are terrified of fillers and not so much of Botox. The worst thing that could happen with Botox is a droopy eyelid or a muscle that doesn't move because the Botox got into a muscle we didn't want to be affected. With fillers, there are lots of bad things that can happen, and patients need to make sure they're going to an experienced injector if they're getting filler injections.
Some of my patients tell me, I am against Botox because it makes you look very unnatural. Do you agree with that?
I think it makes patients look unnatural if they're not injected properly. When I inject a patient, I know the plan for them, and then I see them 2 weeks after the injection to make sure that that plan has worked. And sometimes it needs a little touch up for me to make sure that I'm getting the actual look that I want. Patients also are concerned that they'll have a face that doesn't move. Even if we inject every area in the face that Botox is used for, still your face moves. Still you can smile and talk and blink and do all those things, but the wrinkles and the concerns of aging are improved.
Do you inject Botox every part of your face or on some certain locations?
Well, the places it can be injected are here to treat the 11 lines, the forehead to treat the horizontal lines, the crow's feet to treat the lines that radiate out from the corners of the eye. The corners of the mouth here, we can turn those up. We can fix a dimpled chin. We can treat here the bunny lines. And actually, one of my favorite injections is sometimes people smile and they show their gums. We can put a little Botox here, which brings their upper lip down a little bit so they don't have what we call a gummy smile. We can even inject the bands here in the neck. As we age, there's a muscle in the neck called the platysma that makes a sling, and as we age, it pulls apart. We can inject those little bands and soften those bands with Botox.
Thank you very much. How long does the effect last? How often do I need to do it?
Botox usually lasts about 3 to 4 months, but there are new products coming out that may last 6 to 9 months. So keep your ears open for new and exciting products.
Wow, this is an exciting news. So when do you think those drugs will be available for us to use? When do you think?
Here in the United States, the drug that I'm talking about is called daxibotulinum toxin A. I don't know if Daxi will be the trade name or not, but it is in FDA, the Food and Drug Administration evaluation now, and it should be approved very soon.
Another question that comes often is, we heard that as time goes by, when I have multiple injections, the duration in between increases. Is it right?
Well, interestingly, it's not the duration, but it's the fact that you unlearn the movement. So for example, I can make, well, I can't because I've had Botox, but if I hadn't had Botox, I could make a frown. That is a volitional motion. So if I learn not to move that muscle because I've had Botox, I start to gesture without frowning. So in that way, yes, it does last longer because you unlearn those motions. Now for the crow's feet, I can't say I'm not going to wrinkle my crow's feet when I smile. It's not under voluntary motion. So in this area, we really don't find that it lasts longer because we don't control it. We don't unlearn that motion.
Another question asked is, I heard that it hurts. Are you using a needle to do that?
Interestingly, they've tried research into a cream of Botox because people are afraid of needles, and the cream didn't work. So we're stuck with needles. But we use a very, very small needle that even I can tolerate, and I'm afraid of needles. But we can also put a little numbing medicine on the skin for people who are extremely afraid, and you barely feel the needle stick.
Oh, are the needles big or small? So it's important for me.
The needles are tiny, actually. They're very, very small, and they're very, very thin. Sometimes we can actually put the needle in between nerve fibers, so you don't even feel it going in because it's that small.
So sometimes from the social media, we heard some expressions like lip flip or lip lift. What is it?
Well, the social media has put names to things that we've done for many, many years. So the lip flip is actually Botox placed right along the junction of the skin of the lip and the pink of the lip. And it releases the downward pull of the muscle. So it allows it to come up and you see a little more pink of the lip. We do it for smokers' lines, the lines that we get when we pucker our lips from smoking. Some people don't smoke, but they have those lines because they talk and they pucker their lips when they talk. And so it was noted that when we did those injections, you could see a little more pink lip. So now it's the lip flip. but it's a very safe and easy procedure to do, and it's all over the internet.
Okay, thank you very much. I think we have enough with Botox.